Thank you, Alice, for that enlightening presentation. I'm very happy to introduce Dr. Matthew Springer from University of California in San Francisco, who is a leading researcher on both secondhand tobacco smoke and marijuana smoke. Last month, he appeared on both CBS radio and TV talking about secondhand marijuana smoke. We're happy to have him with us today.
Let me just make sure that I've got the technical aspects correctly. So the clicker button, the green one? I wasn't here before, so I didn't get the orientation. All right, well, so I'm happy to be here to speak to you today. This talk is going to be a little bit different perspective, I think, from many of the other talks in this program, because you've been hearing about marijuana as a drug for better or for worse, and the components as drugs. I've been studying marijuana more as another source of secondhand smoke in the environment. So my history is studying vascular effects of tobacco secondhand smoke. And I wanted to quickly introduce my lab. Here we go. This is work done by my lab at UCSF over the last several years. So we've got various, oh no. Boy, this thing is really touchy. There we go. So my lab collaborators, I also wanted to mention that the work I'm going to talk about has been funded by the Flight Attendant Medical Research Institute, National Institute on Drug Abuse, and the Alpha Force Foundation. So let me see if I can actually use the cursor here. Is this show up? No. Okay. So I think that a lot of you probably are old enough to remember what you just saw ahead of time, what I call the bad old days. You remember being taking a flight used to involve this kind of scene. That may be not quite as bad as all that, but you get the general idea. And fortunately, thanks to the work of public health advocates, like I'm sure many of the people in this room have done this, we no longer really have to worry about unintentionally being exposed to this kind of smoke situation. These days, we're more concerned about this. If we're talking about unintentional public exposure to secondhand smoke from cigarettes, it's more a matter of, oh, you're sitting at a bus stop and someone next to you lights up a cigarette. Annoying, right? But not as bad as it used to be. However, well, here we go again. As marijuana becomes of greater interest to people, both for recreational and medicinal purposes, we're seeing more and more people smoking it out openly. There are whole events based on smoking marijuana. This is a 420-day celebration from a few years ago, I think in Colorado. And actually, this is ironic. You know, I'm from UCSF. UCSF is probably one of the centers of the universe when it comes to research on tobacco smoke and other kinds of smoke exposure. And literally half a mile away is the part of Golden Gate Park where the annual 420 events occur. And as a matter of fact, I downloaded this picture. This is not from this year, this is from last year's 420 event in Golden Gate Park. And that is not fog rolling through Golden Gate Park. That's a cloud of secondhand smoke. So this is a real thing. So let's talk about secondhand smoke for a minute. You know, when we say secondhand smoke, everyone assumes we're talking about cigarettes and tobacco, right? We've been talking about cigarette secondhand smoke for decades in the public health community. So what is known about tobacco smoke is that smoking itself, active smoking, is thought to cause about 140,000 cardiovascular deaths in the US per year. And secondhand smoke in particular is thought to cause about 50,000 deaths in the US, mostly from cardiovascular causes. And this is an important point because people think about the harm of smoking. They tend to think about lung cancer, about lung disease, emphysema, COPD, but actually the vast majority of deaths attributed to secondhand smoke exposure are cardiovascular causes. And so it's very important if we're going to be assessing whether a particular kind of smoke exposure is bad for you, you really need to look at the cardiovascular effects. So as a matter of fact, it's been shown in communities around the world that public smoking bans, in particular indoor smoking bans, are correlated with a substantial drop in hospital admissions for heart attacks. So just reducing the amount of secondhand smoke in the air prevents heart attacks from occurring. So when we talk about the effects of secondhand smoke or any kind of smoke on cardiovascular function, the way that my group and many groups study this is we look at the effects on vascular endothelial function. And what we mean by that is the ability of arteries to grow, expand, when they need to pass more blood. And I've got a, there we go. That they will actually sense that more blood is being shoved through this tube. The inner lining senses that and causes the vessel to grow in diameter. And that is a real-time effect, and it allows your tissues to get the blood and oxygen that they need. This is important also because it keeps your vessels pliable, it keeps them flexible, it can reduce the chances you'll get atherosclerosis later, it can help keep down the chances of a heart attack or a stroke. So this is important. However, people who smoke have poor vascular endothelial function. And it's been known for many years that people who are exposed to a lot of secondhand smoke exposure have poor vascular function, even if they're not being exposed to smoke at the time of the test. So these impairments of vascular function are temporary, but if they're repeated often enough, it can become a permanent problem. So this, we're going to get technical for just a minute. I realize there are very diverse backgrounds in the room. This is not going to be a mostly technical talk, but I want you to understand what we're doing. Because we're looking at the ability of the vessels to dilate as a result of increased flow, this is called flow-mediated dilation, or FMD. So FMD is a measure of how healthy your blood vessels are. And we can actually measure this in humans in the clinic by taking a blood pressure cuff and completely cutting off the blood to the forearm for 5 minutes. And, I mean, that sounds terrible, but I've had it done to me. It's really not that bad. It's just a little annoying. And then we release it, and the blood rushes back into the hand. So it's rushing through this artery that feeds the hand. And as a result, if the artery is healthy, it will undergo vasodilation. And we can use ultrasound to measure the diameter of the vessel before and after this has occurred. So in this particular case, we have, that's the artery there, and it's gone from 4 millimeters before to 4.4 millimeters afterwards, so it grew by 10%. So we say this person has an FMD of 10%, and that's a pretty healthy number. If someone who is sicker, someone who has a lot of cardiovascular risk factors, usually this is a lower number. So to make a long story short, because this is a marijuana talk, we for several years studied the effect of exposure to secondhand smoke from cigarettes in both humans and rats. Most of what we've done is in rats, but we've collaborated with some human studies. And we developed a system that allows us to measure FMD in living rats. It's very similar to how we measure it in humans. They respond very, very similarly. And what we showed that in humans, half an hour of exposure to secondhand smoke impairs FMD. We confirmed that the same thing happens in rats. And I want you to understand how these graphs work because they're very useful ways of seeing what we're doing. And I'm really bad at looking away and still being in the microphone, so I apologize if I come in and out. It's just weakness that I have. So in this case, every line of different colors is an individual rat. And FMD is being measured at 3 times. Before exposure to smoke, after exposure to smoke, and 30 minutes later to see if FMD has recovered. And so with 30 minutes of exposure to smoke, as you can see in most of these rats, FMD went down, and then half an hour later it came up. And we also showed, and this is work that we published in 2014, that even 1 minute of exposure to the tobacco secondhand smoke resulted in a perceptible and statistically significant decrease in FMD. So it's not a huge effect after 1 minute, but it's already started. The problem has already started. And the bottom line of this paper was that even very brief exposures to secondhand smoke, and this was at real-world levels equivalent to what you might encounter in a restaurant that allows smoking. Even 1 minute, you're already starting to see the problem occur. So we published that, and while we were doing this research, I happened to go to a Paul McCartney concert at AT&T Park. And I love to tell this story because this really was very serendipitous for me. I'm sitting here in this outdoor stadium at AT&T Park, and in the middle of the concert, the people in front of me lit up a cigarette. And then other people started lighting up. And I was thinking that, how could, they're not supposed to smoke in AT&T Park. And then the smell gave it away, and I realized, oh, this is pot, and this is a Paul McCartney concert. Okay, I get it. And pretty soon, there was a haze covering the stands. And Paul McCartney even stopped the concert. Between songs, he stopped and said, something in the air, must be San Francisco. So, and people laughed, and I thought it was pretty funny, but at the same time, I was struck by the fact that there were all these people in the stands that probably would not tolerate the person next to them smoking a cigarette, and yet they thought that the marijuana smoke was okay. So I thought about that a little bit more, And it occurred to me that there are a number of reasons that people might have this impression. So tobacco, marijuana, they're both dried plants. That you burn them, they make smoke. But people think about marijuana and they say, well, there's no nicotine. It's natural, whatever that means. It's medicinal, right? I mean, medicinal marijuana. But I think most importantly is nobody has said it isn't okay. And here's a major point. We in the public health community have been hitting people over the head for decades that tobacco, secondhand smoke, is bad for you. So if we don't tell them that marijuana secondhand smoke is also bad for you, it must be okay. And I think that this is a major problem. Now, why haven't we said it's bad for you? Because we haven't had evidence that it is. We haven't done the experiment. It's very difficult to do experiments like this with marijuana if you're talking about humans. But we have this great rat system. So I figured we are perfectly poised to do the experiments in rats and see whether the rats respond similarly to the marijuana secondhand smoke as they do for the tobacco secondhand smoke. So now, why would we suspect that marijuana secondhand smoke would be a problem also? When you burn any plant material, you get thousands of chemicals, and a group in Canada did a very nice study where they did a detailed chemical comparison of different ways of generating smoke from tobacco and marijuana. And basically what they showed is that for almost every chemical, the notable exceptions being the nicotine and cannabinoids, for almost every chemical, if it was in one smoke, it was in the other. So you don't have to read this. This is just an example of the kind of study that they did. And if we sort of pull sort of better, there it is, if we pull a better representation out there, you can see these chemicals are present in both smoke. They're different ratios, so there are some differences, but thousands of chemicals in both kinds of smoke. So we're essentially inhaling a whole chemistry lab if you're breathing smoke. So we decided to dive in, and I don't know, there might be people here from the regulatory agencies who will appreciate this slide, I think. We entered this wild and wacky world of marijuana regulation, and well, we had to answer questions like this one. Is the researcher human? Which, honestly, I don't remember what I said. You're pretty sure you know what they mean, but on the other hand, you don't want to lie to the DEA. It's going to come back to you afterwards. But to make a long story short, we did the experiment, and we presented our preliminary results at an American Heart Association conference in Chicago in late 2014. And here's a summary of what we presented in that conference. We did the same experiments that we had done with tobacco, but for marijuana. Now, I should say right out that we have a pretty good idea of the ambient levels of tobacco smoke in a lot of social situations, but we don't know that for marijuana, so we had to make some assumptions. And so we took that same level of smoke that you would expect to find in a restaurant that allows smoking, and we called that our high dose of marijuana smoke. And I figured, okay, that's, if you're in a rock concert or a party where people are smoking, there's clouds of smoke in the air, it's a reasonable assumption. And then we took 1/3 that level as our low dose. And so if you just look at these two graphs, they look somewhat familiar. This is again a 30-minute exposure. See before, after, FMD is plummeted. The one difference is that if this were tobacco, FMD would be completely recovered by 30 minutes later, and in this case, it hadn't recovered very much. These buttons are too close together. I think that's why I keep getting multiple buttons. You get these big, thick fingers. Now, we also used THC-depleted marijuana. We got all of this from NIDA contractors. And so there was marijuana from which all of the cannabinoids had been removed chemically. And when we used that marijuana, we saw the exact same effect. So this confirms that the THC is not causing this. None of the cannabinoids are causing this. Not terribly surprising because tobacco smoke does the same thing, right? As a matter of fact, it's interesting that in tobacco smoke, apparently the nicotine is not required because we're getting it from marijuana as well. And then as a control, we used air, and we didn't get any overall changes over time. So we presented these results, and this was very useful because you got all the comments, you know, these stories online. You know, if you look at the comments after those stories, clearly most of those people are just nuts. But, you know, there are a few people who ask good questions, and so that was very helpful. And we got good questions from reporters, etc. And so before the paper that we just published a few weeks ago in Journal of American Heart Association, we had a chance to answer a number of these questions. And so one of the questions that we got was, well, that was a 30-minute exposure. That might not be very relevant to a typical marijuana situation. Well, we had already shown that tobacco smoke has an effect within 1 minute, so we decided to do that experiment again, see if 1 minute of marijuana secondhand smoke would have an effect, and the answer was yes. there's 1 minute of marijuana secondhand smoke. FMD has gone down by almost 60%. So that was pretty impressive. Another question was, you say that marijuana and tobacco burning smoke causes this effect, but how do you know it's not smoke from the rolling paper? And when I first heard that, I thought, well, that's a little bit of a stretch. But then I realized, actually, it's a reasonable question for two reasons. First of all, that rolling paper has burn accelerators, chemicals in the paper. And so it's a valid question. Maybe that they're doing something. And second of all, in particular for marijuana, a lot of people smoke marijuana in glass pipes where there is no rolling paper. So the way that we approached this is we replaced the paper with stainless steel mesh. We made basically chainmail cigarettes, and we burned those. And we only did four cigarettes, or 4 animals, I should say, in this experiment. But that was enough to see that clearly the paper is not required for this impairment. So here we've got THC is not required, rolling paper is not required. It's the smoke from the burning plant material. Now this was basically a misconception, but we kept hearing it, which was that, well, they must be smoking out these rats. You know, I think people were picturing these opaque clouds of smoke that the rats were inhaling. And, you know, a few decades ago, that's how people did tobacco research. They massively overexposed animals. But what we have been doing with both tobacco and marijuana, we have, as I said, been using real-world levels of smoke. And in fact, in the paper that we published, we even showed a picture of our exposure chamber. This is what the smoke looked like when we were doing the experiments. So you can't see it. It's completely clear. So I hope that laid to rest that misconception. And lastly, I think this is the most interesting part. How long does it take for the FMD to recover? Because we had shown that if you exposed to tobacco smoke, it's recovered within 30 minutes, and with marijuana smoke, it hadn't recovered in 30 minutes. So how long? So we did a 1-minute exposure. This was the THC-free marijuana, because we were out of the other stuff at that point, but we had already shown that they were equivalent. So 1-minute exposure. 30 minutes later, there's the FMD is impaired, as we know. 30 minutes after that, FMD is still impaired. 30 minutes after that, FMD is still impaired. We've got this one outlier rat, and a couple of them have started to come up, and most of them haven't changed. So that's as long as we took the experiment out, though. We were actually very surprised that we didn't plan to see no recovery by 90 minutes. But tobacco, it recovered within 30 minutes. Marijuana, it was just starting to recover in 90 minutes. Okay, so one other thing that we looked at was how the marijuana and the tobacco really compare. Because if you think back, when I showed you the 1-minute result from tobacco earlier in the talk, it was a very modest effect. And so for a while we were saying, wow, you know, the marijuana smoke, we had almost 60% drop, where tobacco we just had a little bit. So we were saying it looks like marijuana has not only a longer effect, but a larger effect. But that was a historical comparison. You can't really do that. We really needed to compare them head to head. And so we did, in one more experiment before we published the paper, head-to-head direct comparison of tobacco, marijuana, and air. And interestingly, in this case, I don't know, maybe we're just better at doing this now, the 1 minute of tobacco actually had a pretty substantial impairment as well. So we actually got comparable impairment from tobacco and marijuana. But in the case of the tobacco, again, it recovered within 30 minutes. In the case of the marijuana, again, it didn't. So what we're saying at this point is that they've got comparable size of effect, but the marijuana effect lasts a lot longer. So to summarize the results I've shown you so far, marijuana, the secondhand smoke from marijuana, for 1 minute substantially impairs blood vessel function in the rats. And I want to mention that, yes, these are rats, and people ask about that. They're not humans. I think it's important to realize that what we're looking at in rats is very similar to what people look at in humans. And humans and rats respond similarly to tobacco secondhand smoke. And we're showing that rats respond similarly to tobacco and marijuana secondhand smoke. So it's a reasonable extension to think that the humans will respond similarly to the rats to marijuana secondhand smoke. So 1 minute substantially impairs function in rats. THC is not required. Paper is not required. It's coming from the burning dried plant material. And interestingly, nicotine from tobacco apparently isn't required either. And this 1 minute of marijuana smoke, secondhand smoke, impairs the blood vessel function for at least 90 minutes, which is quite a bit longer than that from tobacco. So what does this mean then? What are the implications of this? Well, this is an interesting example. This is from the Toronto Star. Apparently in November of 2015, the Deputy Health Minister of Ontario decided that they were going to make sure that medicinal marijuana patients could use medicinal marijuana whenever and wherever they wanted to. And so they said that the policy will be that as long as you have a prescription or ID card or whatever they have in Ontario, I'm not sure, you can not only vaporize but even smoke marijuana in even enclosed public places, including movie theaters, schools, etc. That was November 25th. November 26th, according to the Toronto Star, there was a big public backlash. and they took a step back and said, okay, we need to rethink this. But let me tell you the scary part. According to the analysis in the newspaper, the reason that they jumped the gun like this is, and this is what the paper said, they had only consulted with the medical community and had not yet consulted with the entertainment community. It was the entertainment industry that said, we don't want this. And I looked at that and I said, oh my God, this is so twisted. You know, we need to understand all of the ramifications of exposure to this smoke. One more thing that I'll mention is that as a result, partially a result of the study that we did, Jim Woods, a California assemblyman, wrote a bill that clarified California law, saying that if landlords have prohibited smoking in their rental units of tobacco, they can also prohibit smoking of marijuana, even medicinal marijuana. The concern was smoke transfers to the next units, and there's also concern about the so-called third-hand smoke. I'm not sure if you've heard about that, but even after the smoke clears from a room, chemicals that have stuck to the walls can then be re-released into the room. This could happen with marijuana also, we're not sure. So that bill, they said that our research was one of the major reasons that they did it. It passed the Assembly Judiciary Committee unanimously. It passed the Assembly unanimously with 3 non-votes. I don't know if that means abstentions. Went to the State Senate Judiciary Committee, and they just shelved it a few days ago until next year because there was disagreement about how much this would limit the access of medicinal marijuana patients to their drug, which is a legitimate issue. And I'm not going to spend too much time here talking about it, but I did want to mention that what we have shown here is from combustion products of smoke. We don't know this for sure, but it's a reasonable chance that what we've shown here is not relevant to people taking the edibles and people using leaf vaporizers. So I look at that and I say, well, we're not suggesting that people can't take THC. We're suggesting that you should do it in a way that avoids exposing other people to smoke. That's my view. So this brings us to policy goals. I'm almost finished. The main policy goal, the bottom line of this is, as far as I'm concerned, public exposure to secondhand smoke should be avoided, whether the source is tobacco or marijuana. Now, is marijuana secondhand smoke bad for you? I can't say for sure. I think I've given you evidence that it might be, and I think that's enough to say that when we protect the public from unintentional exposure to secondhand smoke, these laws and regulations need to be written widely enough that it's clear that marijuana smoke is included, not just tobacco smoke. But I think more importantly, for the public perception, we need to change the dialogue. So you remember this slide I showed you earlier. There it is. This slide that I showed you earlier, the reasons that people think that marijuana smoke is probably not bad for you, well, no nicotine, I think we need to change that to there's tar and chemicals. Okay, it's still smoke. It's natural. I hope we can change it to it's gross. It's still smoke. You know, it's natural doesn't really mean anything if you think about it. So it's medicinal, okay, I grant that, but the smoke is bad for you. So there might be some good things in it, but the rest of the smoke is bad for you. And last but not least, no one has said it isn't okay. It needs to change into it isn't necessarily okay. And so I'm going to stop there and take a few questions. I did want to mention one thing, though, just to clarify. I do not consider this to be an anti-drug message, necessarily. It's not even an anti-marijuana or an anti-THC message. We have shown that THC is not responsible for the deleterious effects that I've been talking about. And people have actually asked me frequently about the leaf vaporizers. Would the leaf vaporizers avoid the problem that you get from inhaling combustion smoke? There's a good chance that the leaf vaporizers are better for you. We don't know that for sure, and actually I have this recurring nightmare that everyone switches to leaf vaporizers and then it turns out that they're also bad for you, but they did it because Dr. Springer said it was okay. So we actually now have a grant that we got recently to study whether the leaf vaporizers like volcanoes and tax devices, whether the vapors from those also have the same harmful effects. And so stay tuned, hopefully within the next year. we'll have the answer to that. So I'll close there and take any questions. Okay, so this question, if nicotine and THC are not implicated in secondhand smoke problems, how do you know that any plant that's burned wouldn't cause FMD, wouldn't cause presumably impairment of FMD? What happens if you burn, say, oregano and inhale that smoke? What is the role of smoking it, of smoke itself? So you're reading my mind. Do you know that in the grant application that we submitted, we said we were going to do oregano. So whoever answered that question, we said we were going to do oregano, and then I decided, well, you know, that could be pretty foul. Why don't we try parsley instead? And I actually have a parsley cigarette in my lab that we put together. There were just too many things to do, so we haven't gotten around to that experiment yet. But I would imagine that parsley smoke or oregano smoke would do this too. Herbal cigarettes, cloves, things like that, right? Forest fire smoke, air pollution, all of these things have been implicated with cardiovascular problems. And that's one of the reasons that I think that we can start off with the assumption that marijuana smoke is going to have these effects too, because I don't see how marijuana smoke would be somehow exempt from the effects of all these other disparate kinds of smoke. So I hope that that answered the question. Okay, so do filters on cigarettes impact FMD recovery time for secondhand smoke? And what is FMD impact and recovery time for wood and charcoal smoke? Okay, both good questions. For the filters on cigarettes, I don't know the answer to that. I think the filters actually, from what I've heard, don't do a whole lot. Okay, as a matter of fact, there is a proposal to ban filters on cigarettes, believe it or not, because the filters themselves aren't actually doing a whole lot, but what they do is they accumulate in the environment and release toxic chemicals into the stream. So the marijuana cigarettes that we've used were filterless, okay? We have used filtered Marlboro Red cigarettes, and we've also used filtered little cigars, Swisher Sweets little cigars, and we basically see the same effects from all of these, just with the exception of the duration. And I don't know if the filter affects that or not, because we haven't done it. FMD impact and recovery time for wood and charcoal smoke, I have no idea. One of my colleagues at San Francisco General is starting up a wood smoke project with human exposure. So hopefully we'll have some idea about that. And then I also got this, this one, during a recent raid of 10,000 plant grow, it's a little hard to read, our officers found carbofuran spray on a portion of the plants. Are you familiar with what the carbofuran would do to the person who smoked marijuana bud that was sprayed with carbofuran? And what would the secondhand smoke effect be? Okay, so the specific chemical, I don't know anything about that chemical. I imagine that the more chemicals are in something, the less you want to breathe it. But this brings up an important point. One thing that I didn't think I had time to go into, but since the question was raised, a lot of people, when I initially said we're studying the effects of the marijuana secondhand smoke, they said, well, you know, it's not going to be as bad because tobacco has all those chemicals added to it from the tobacco companies and things like that. Well, so clearly the marijuana smoke has had the effect too. And one advocacy group asked me whether there were pesticides on the marijuana. So I checked into it and I confirmed that there were no pesticides on the marijuana. So our marijuana results are coming from chemically untreated material. I think one last question. Considering you studied marijuana wrapped with steel mesh, is marijuana wrapped with cigarillo wrappers, aka blunts, worse in terms of secondhand smoke and toxins than compared to standard cigarettes? Usually blunts are rolled from the wrappers of Swisher Sweets, Black Miles, Phillies, or other similar cigarillos. Well, let me see. I don't know that there would really be a difference. The Marlboro Red cigarettes that we did that have regular paper wrapper and the Swisher Sweets filtered little cigars that actually have the cigarillo wrapper, tobacco containing wrapper, there were basically no differences between those two. And since the wrapper itself is not required for this very extreme response that we see from the marijuana, I would say that it's probably inconsequential. But we haven't done a detailed comparison of the different kinds of wrappers. I think that's all. So I'll stick around for a bit after.
Thank you, Dr. Springer, and he'll be available again if you have additional questions. There's one we didn't have time to get to. So we are now going to offer an early and light lunch with a beverage. So please get your food quickly and come back. We'll take just 15 minutes for lunch. And we're going to switch our order. We're going to have Kim Gerhardt. Sergeant Kim Gerhardt will be our next speaker from Colorado.